Welcome to Wellness by Mommy. I hope you are safe and sound. In today's video, let's talk about cervix or cervical dilation in pregnancy. During labor, contractions cause the cervix to change from being closed to fully dilated or open to 10 centimeters. Once that happens, it's time to begin pushing. Watch till the end to learn more about dilation during pregnancy, including how dilation is measured, signs and symptoms, phases, and many more. Dilation is the opening of the entrance to the womb. It happens during labor. Dilation is the process by which the cervix opens during childbirth. The cervix is the lower part of the uterus, where it opens to the vagina. During pregnancy, your cervix plays a crucial role in protecting your growing baby. It's closed to keep the baby safe inside the uterus. Then, in labor, contractions help your cervix to open, or dilate, to allow the baby to descend through the birth canal. Cervical dilation is measured in centimeters to determine the different stages of labor. Your midwife or doctor might offer to perform a cervical check, and compare that information with the frequency of your contractions and stage of labor. Symptoms: dilation is caused by contractions. These contractions cause the muscles in your abdomen to become very tight, then relax. At first, these contractions may be mild and barely noticeable. As labor progresses, you'll experience more intense contractions. You'll also notice other symptoms of active labor, including strong, regular contractions that cause pain in your abdomen and back. Increased discharge, which may be bloody, brown, or contains mucus. Water breaking or when the amniotic sac ruptures. There may be a gush or a trickle of amniotic fluid, or it may not happen until late in labor. Signs your cervix is dilating. There are several signs that can tell you that you're dilating without the need of an internal examination. Before you start dilating, your cervix must soften and shorten. This is called cervical effacement. If this isn't your first birth, you might dilate and efface at the same time. I will talk about effacement in the next video. How do you know if your cervix is dilating? Here are 5 signs that some women notice. Lightning crotch. Sharp shooting pains felt in your vagina happens as women get closer to their due date and when cervical dilation begins. The pain is a result of your baby's head pushing on nerves as it descends into the pelvis. As your cervix begins to dilate, you may see a clear, pink, or brown discharge as a result of the mucus plug being released. This is an obvious sign that you're dilating, but it's important to seek medical guidance about vaginal bleeding, particularly if you're earlier than 37 weeks, if the bleeding is bright red, or is more blood than mucus. Cramping and backache. If you feel cramps just above your pubic bone, this can be a sign that you're dilating. A dull ache in your lower back at regular intervals can be the start of labor contractions. You can't hold a conversation. During early labor, you can probably talk and move around. As your cervix starts to dilate, you might stop talking and instead focus on your breathing and moving your hips. As labor progresses, you could find yourself making all sorts of sounds, and become unaware of what others are doing or saying around you. Cervical checks. The easiest way to assess dilation is for your midwife or doctor to do a cervical check. This isn't always comfortable for women, particularly during active labor. It involves lying on your back, with your care provider inserting 2 fingers into your vagina. This check also helps them to assess the position that your baby is in. Phases of dilation. First stage. During this stage you experience regular contractions, increasing in intensity. All dilation takes place in the first stage of labor. The first stage lasts for many hours. Second stage. The second stage is when you are actively pushing your baby out. It lasts from minutes to 3 hours. This stage begins when your cervix is fully dilated. Third stage. The third stage is the delivery of the placenta, which often takes about 30 minutes. When to go to hospital? It can be hard to tell when labor has started. If you're not sure or are worried, call your hospital. They will ask you how and where you feel your contractions, how often they come, and how long they last for. If there are strong signs of labor, such as your water breaking, regular contractions, or blood loss, contact your hospital anyway. When there is less than 3 to 5 minutes between contractions, it is time to go to the hospital. How dilation is measured? Dilation is measured in centimeters. For most of the pregnancy, the cervix is closed. However, as labor approaches, the cervix opens as it begins to prepare for childbirth. Some people become 1 to 2 centimeters dilated before they start labor, while others start labor without being dilated at all. When your cervix is fully dilated, the opening will measure 10 centimeters or about 3.9 inches. That's the same diameter as a large bagel or cantaloupe cut in half. It's large enough for the baby's head to pass through. Checking dilation. When you are in labor, your healthcare provider will check your dilation through a cervical exam. During this exam, they will insert their gloved finger into your vagina to check how wide the cervix has dilated. Most people do not find these exams painful, although they can be uncomfortable. Unless there are complications, your healthcare provider will likely check you when you are admitted and before you begin pushing. Checking dilation too frequently can introduce bacteria to the vagina. Complications? While dilation is a natural process, it doesn't always go seamlessly. Some people experience complications with dilation. If your cervix cannot fully dilate, your healthcare provider may suggest a cesarean delivery, C-section. Induced dilation. Sometimes, your healthcare provider might decide that inducing labor, or artificially jump-starting it, is what is healthiest for mama and baby. This may happen if you're more than 2 weeks past your due date, your water broke, but labor didn't start, you have health concerns, such as high blood pressure or low amniotic fluid. If you need to be induced, your healthcare provider will likely use various means to encourage dilation and the start of labor. These may include using the hormone prostaglandin. Prostaglandin causes the cervix to soften and efface. Prostaglandin can be taken orally or inserted into the vagina. Using the hormone oxytocin, in the form of the medication pitocin, to induce contractions, which cause dilation. Using a Foley bulb induction, where a catheter is inserted into the cervix. The catheter is slowly injected with saline solution, putting pressure on the cervix and causing it to open. When dilation happens too early, if labor starts before 37 weeks, it is considered preterm labor. A fetus born too early faces risks, including death and serious illness. If you're experiencing early dilation, your healthcare provider might suggest treatments to try and reduce your risk of preterm labor. They may also provide steroids that will help your baby's lungs develop in case they are born early. The treatments for preterm labor include progesterone, when given as a shot or inserted into the vagina. This hormone can reduce the risk for preterm labor. Cerclage, if your cervix begins to dilate very early, your healthcare provider may use stitches to sew the opening closed. This is known as cervical cerclage. The stitches are removed at 36 weeks gestation, allowing for normal dilation during labor. Your healthcare provider may also recommend bed rest or reduced activity to help prevent further dilation. Please note, anticipating labor can be both exciting and scary. Knowing what to expect can help you feel more in control, but remember, there's no way to know what will happen when it's time to give birth. Surrounding yourself with trusted healthcare providers, well-informed and understood information and loved ones can help you feel confident when the time comes. It's normal for contractions to start and stop before true labor sets in. Unfortunately, that can make actual labor hard to spot. Once your contractions last for 30 to 70 seconds and are 5 to 10 minutes apart, it's time to call your healthcare provider. Some healthcare providers will check dilation as you approach your due date, but this isn't an indication of how far or close labor is. Most people will have a cervical check when they get to the hospital and before they start pushing. Dilation can take hours or days. It is highly individualized. As long as your body is making steady progress, your healthcare provider will likely allow your body to dilate until you reach 10 centimeters. I hope you find this helpful. Please subscribe for more interesting, evidence-based, educative and informative videos. Like and share this video. Turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy. Peace.